Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see another knowledge booster dose, that is a knowledge booster dose part 21. In that we are going to see on one-liner questions, their answers with additional explanation. One-liner questions with added explanation. We have already seen 20 parts of knowledge booster dose. If anybody has not seen previous video, please go in the channel's playlist and watch all the previous video, because they are very important for your GPAT Niper Drug Inspector and Government Pharmacist exam. My dear students, first question of today's session is nothing but the which drug is used for maintenance program for opioid addicts. Which drug is used for the maintenance program for opioid addicts? Opioidal addiction जो होता है उसमें maintenance drug कौन सा है? So the answer for this question is nothing but the methadone. So methadone is the drug which is used for the maintenance program of opioid addicts or opioid addiction. So first of all, you should know what you mean by opioid addiction. So opioidal drugs like morphine, codeine, thibaine, then heroin. So particularly morphine and heroin has a very more liable for the addictions. They are liable for addictions. So a lot of addicts they got addicted due to this morphine and heroin. Okay, so if there is addiction to the morphine or opioidal drug, so it causes physical as well as psychological dependence. So morphine causes physical as well as psychological dependence. Psychological dependence means there is a craving, there is a lacrimation, there is a thirst. Okay, there is a thirst and the patient can do anything for the drug. So he's basically craving for the drug. So physical dependence means there is certain change in the your body physically. So there is a abdominal pain, cramps, diarrhea, etc., etc. So bone pain, body ache. So basically that patient needs opium, that patient needs morphine. That is known as a morphine addiction or opioidal addiction. Now in that case, so you should not withdraw morphine suddenly, because अगर आपने suddenly morphine का withdraw किया, so what will happen? So there is a development of withdrawal symptoms and they are very severe. Okay, so to prevent the withdrawal symptoms, you have to decrease the dose of morphine slowly. You have to withdraw the morphine slowly, and you have to include methadone. What is methadone? Methadone is again synthetic opioidal analgesic. So, but it will not have addiction property. It will not let the withdrawal symptoms to occur. Okay, and slowly you have to decrease the dose of morphine and you have to include this methadone. And methadone also you have to withdraw slowly, not suddenly. So remember, maintenance drug for opioidal addiction or maintenance dose for maintenance drug for opioidal addiction, maintenance drug for opioid addicts is a methadone. Now next question we'll see question number 82, opioid used for the cough suppressant or opioid used as a cough suppressant. So you know that in the central analgesics or opioidal drugs you have different kind of drugs. So basically your opium alkaloids are divided into two types. First one is known as a phenanthrene alkaloids. So in the phenanthrene alkaloids you have morphine, codeine, thibaine. Now in another type of alkaloid is known as a benzyl isoquinoline type of alkaloid. In that you have papaverine and narcotin, noscapine, etc. So opioid used as a cough suppressant. The answer of this question should be codeine. Okay, codeine is a cough suppressant. Codeine, phalcodeine, they are a cough suppressant, right? But since semi-synthetic derivative of this codeine is a dextromethorphan, so that is the answer. So dextromethorphan. So dextromethorphan is a semi-synthetic derivative of your codeine. What is codeine? Codeine it has an analgesic activity as well as cough suppressant activity. So it will decrease the threshold of cough reflex. So it is a cough suppressant or central cough suppressant. So codeine, phalcodeine, and their semi-synthetic derivative known as a dextromethorphan. So that is the drug used for the cough suppressant, right? Now you have to remember, codeine is a less analgesic than morphine but is a cuff suppressant, and codeine is metabolized in the body to a morphine. So remember, every 10 milligram of codeine will be converted into the body into 1 milligram of morphine. So 10% there is a conversion of morphine into codeine in the body, right? One of the major adverse effect of codeine is nothing but the constipation. You have to remember, constipation is the adverse effect. Now we'll see the next question. Question number 83. Drug of choice for absence seizure. Drug of choice for absence seizure. So again, it is a very important question. So what is the drug of choice for absence seizure? So answer for this is nothing but the ethosuximide. Ethosuximide. And valproate is also some kind. Valproate is also drug used in the absence seizure. Now what do you mean by absence seizure? So seizures, they are classified into different type, like a generalized seizure, generalized tonic-clonic seizure, or major epilepsy, or grand mal epilepsy, then minor epilepsy, then absence seizures. So in the absence seizure, there is no any tonic or clonic movement of your body. Muscle clonus will not be there in the absence seizure. So in the absence seizure, what happens? There is a sudden cessation, sudden stopping of ongoing activity. Suppose you are walking and you suddenly drop on the floor. So that is a kind of absence seizure. Some childrens, if they are doing something, if they are playing, so sudden head drop. So that is the absence seizure. So drug of choice in the absence seizure is nothing but the ethosuximide. Drug of choice in the absence seizure is nothing but the ethosuximide. So you have to remember. Now, what is the mechanism of action of this ethosuximide? So, ethosuximide is known as a calcium channel blocker. So, it blocks the calcium T current in the thalamic neurons. So, it blocks the calcium T current in the thalamic neurons. You have to remember, it is a T current calcium blocker. Ethosuximide. It is a drug of choice in the absence seizure. So, other drug also used in the absence seizure, for example, valproate, carbamazepine, etc., etc. But drug of choice in the absence seizure is nothing but the ethosuximide. Now we'll see the next question. Question number 84. First line treatment for eclampsia. First line treatment for eclampsia. So basically, what do you mean by eclampsia? So eclampsia क्या होता है ये मालूम होना चाहिए. So eclampsia is nothing but there is a seizures, there is epilepsy in the pregnancy. When there is any pregnant woman, so in the duration in the pregnancy period, what happens? There is a seizures, there is a hypertension. Okay, now that is known as a eclampsia. So particularly if there are seizures in the pregnancy, it is known as eclampsia, and if there is a hypertension in the pregnancy, it is known as a preeclampsia. There is a little bit difference. So drug of choice or drug used to decrease the hypertension in a preeclampsia is nothing but the magnesium sulfate. So magnesium sulfate is a drug which is used in the treatment of preeclampsia. So first line drug for preeclampsia is nothing but the magnesium sulfate. Or suppose they ask you a question like this: a drug used in the treatment of hypertension in the pregnancy. So magnesium sulfate. So drug of choice in the treatment of hypertension in the pregnancy, there is a magnesium sulfate, right? So eclampsia means seizures in the pregnancy. Preeclampsia means blood pressure in the pregnancy. For eclampsia, drug of choice is the magnesium sulfate, and for preeclampsia, drug is nothing but the methyl dopa. Okay. So first line treatment for eclampsia means seizures in the pregnancy. Drug is nothing but the magnesium sulfate. And first line treatment for pre-eclampsia, pre लगा दो इसकी पहले. So pre-eclampsia means hypertension in the pregnancy. Eclampsia means seizures in the pregnancy. For the first line treatment of eclampsia, magnesium sulfate. For the treatment of pre-eclampsia is nothing but the methyl dope. Right. Now next question we'll see. First line treatment for acute epilepsy. So epilepsy means what? There is a continuous firing of neuron. There is an increased activity of neuronal membrane. There is increased generation of impulse. There is increased conduction of impulse. So continuous firing of neuron that result in the epilepsy. So first line treatment for acute epilepsy is nothing but the diazepam. So what is diazepam? It is a benzodiazepine derivative, right? So it is nothing but the GABA A receptor agonist. So it increases the frequency of chloride ion channel opening, which causes the post-synaptic membrane to hyperpolarize, and that's how it exits a depressant effect on the CNS. So diazepam is a GABA receptor agonist which increases the frequency of chloride ion channel. कितना क्लोराइड अंदर जाएगा, ज्यादा जाएगा या कम? तो नॉर्मल से ज्यादा क्लोराइड अंदर जाता है. It increases the frequency of opening of chloride ion channel. Okay, remember diazepam is a drug of choice in the status epilepticus. Diazepam क्या है? It is a drug of choice in the status epilepticus, right? So it is a first line treatment for acute epilepsy. Again, now diazepam is metabolized in the two metabolites. Diazepam in the body, after metabolism it is converted to oxazepam and temazepam. So you can say diazepam is a prodrug of temazepam, oxazepam, or you can say oxazepam, temazepam, they are active metabolite of diazepam. So this is very important. We'll see the next question again. Question number 86. Fetal hydantoin syndrome is a teratogenicity caused by. Fetal hydantoin syndrome is a teratogenicity caused by. So in that question only you will get the answer of this question. So यहाँ पे देखो hydantoin आ गया. So hydantoin मतलब क्या है? Phenytoin. So it is a hydantoin derivative. So in the fetal hydantoin syndrome, that is a teratogenic effect caused by phenytoin. So answer for this question is nothing but phenytoin. Now what is phenytoin? It is a drug used in the epilepsy. It is a sodium channel blocker. It is a hydantoin derivative, right? So it causes some teratogenic effect like fetal hydantoin syndrome. So what happens in that fetal hydantoin syndrome? So it is a kind of teratogenicity caused by phenytoin. Phenytoin is a sodium channel blocker. It is used in the treatment of epilepsy. Also, it is a membrane stabilizer. Also used in the your arrhythmia, cardiac arrhythmia, right? So remember, fetal hydantoin syndrome is the teratogenic effect of phenytoin. So it is the teratogenic drug. Now remember, phosphatoin is nothing but the ester of phenytoin. Means phosphatoin is a prodrug of phenytoin. Phosphatoin is a prodrug of phenytoin, right? Now question number 87, we'll see. Neural tube defect is caused by which drug? So neural tube defect is adverse effect of which drug? Or neural tube defect is a teratogenic effect of which drug? So you have to remember carbamazepine, valproic acid, they causes the neural tube defect. Carbamazepine, valproic acid or deficiency of folic acid, that also result in the neural tube defect. But basically what do you mean by neural tube defect? So neural tube defect मतलब क्या? So if there is a faulty development of your neural tube or spinal cord, that is known as a neural tube or spinal cord, known as a neural tube defect. So including CNS and spinal cord. So in the neural tube defects you will have spina bifida, then different conditions under neural tube defect. So spina bifida is one of the neural tube defect which is caused by valproic acid, carbamazepine, then due to deficiency of folic acid also. So neural tube defect during the birth. So there is a inadequate development of your neural scheme. So neural neurons जो थे develop नहीं होते. So one of the neural tube defect is nothing but the spina bifida and encephaly. There is a less development of your hemispheres of cerebrum. Cerebral encephaly is decrease in the formation of cerebral hemisphere. So they are also neural tube defect. So but spina bifida is the one of the neural tube defect caused by valproic acid, carbamazepine, then your deficiency of folic acid, and most of the anti-cancer drugs they also cause the spina bifida problem. Right? Now what is valproic acid? Again it is a sodium salt of valproic acid which is also used in the treatment of epilepsy. There was a question in the last year, what is the mechanism of valproic acid? So what is the mechanism of valproic acid? How it exerts a CNS depressant effect, how it exerts anti-epileptic effect. So valproic acid is an anti-epileptic, acts by 4 reasons. So first, it increases the GABA action. Now it facilitates the GABA action by 1, by increasing the synthesis of GABA. By increasing the synthesis of GABA, by stimulating the GABA synthetase enzyme. So GABA is nothing but the inhibitory neurotransmitter in the brain, right? So it increases the level of GABA by stimulating the GABA synthetase enzyme. First, okay, mechanism. Second mechanism, it decreases the metabolism of GABA by inhibiting the GABA transaminase enzyme. So it decreases the metabolism of GABA by inhibiting the GABA transaminase enzyme, right? Second. Now third mechanism is nothing but it is also sodium channel blocker, and fourth mechanism it is also a calcium T current blocker. So valproic acid is known as a broad spectrum anti-epileptic drug. So in this question number 87, I have covered at least 3-4 questions. So valproic acid is a broad spectrum anti-epileptic drug. It acts by four mechanisms. It increases the synthesis of GABA by stimulating the GABA synthesis. It decreases the metabolism of GABA by inhibiting the GABA transaminase, because GABA transaminase is the enzyme which metabolizes the GABA, right? Now it also blocks the sodium ion channels. It also blocks the calcium T current. So it is a broad spectrum anti-epileptic drug, and is a drug of choice in the lot of conditions, a lot of types of epilepsy. Now question number 88, barbiturates facilitate GABA action by dash of chloride channel. So by GABA is the receptor, gamma aminobutyric acid is the neurotransmitter in the brain. So it has a receptor GABA A. So on the GABA A, benzodiazepines and barbiturates they act. Now what is the basic difference in the mechanism of barbiturates and your benzodiazepines? Question was there once. Now barbiturates they will facilitate the GABA action by opening the chloride ion channel, but they opens the chloride channel for longer duration, so they increases the duration of opening of chloride channel. So बहुत देर तक क्लोराइड अंदर जाता है, ठीक है, लेकिन जितना नॉर्मल जाता है उतना ही. So they increases the duration of chloride ion channel opening in the GABA. Now benzodiazepines they also act via same way, but they increases the frequency of chloride ion channels. So number of chloride going inside, that is increased by benzodiazepines. Now by barbiturates they opens the channels for longer time. Barbiturates facilitate the GABA action by opening the chloride ion channel duration, right? Next question, which inhaled anesthetic is a hepatotoxic? So inhalation anesthetics which is hepatotoxic. So all the halogenated hydrocarbons they are hepatotoxic. So example answer is nothing but the halothane. So halothane is a hepatotoxic. Halothane, isoflurane, n-fluorine, sevoflurane. So all these are the inhalation anesthetic agent. Particularly they are halogenated hydrocarbons. So halothane has a hepatotoxicity. Again halothane, isoflurane, n-fluorine, sevoflurane also has a one more adverse effect known as a malignant hyperthermia. So that will come in the upcoming question. I will explain. So remember halothane causes the hepatotoxicity. Now next question, question number 90. Most common drug used for the endoscopy. So that means they are the basically they are asking the example of anesthetic which is commonly used in the performing the endoscopic surgery. So it is nothing but the midazolam. So what is midazolam? So midazolam is a benzodiazepine derivative. It is known as a triazolam derivative. Benzodiazepine derivative है, but it is a triazolam derivative. Remember, it is not a normal benzodiazepine. It is a triazolam. There is a 3 nitrogens in a ring. Triazolam derivative. So remember, midazolam is a triazolam derivative. It is an anesthetic agent. Now next question we will see question number 91. IV intravenous anesthetic used for the rapid and short procedure. So for the short procedure or daytime surgery, which IV anesthetic is used for the rapid and short procedure? So answer for this question is a propofol. So propofol is nothing but the anesthetic agent which is having short duration of action, rapid induction and rapid recovery. So ये जो propofol anesthetic agent होता है इसको induction जल्दी होता है. So it induces the anesthesia rapidly for short term and recovery is also rapid. So patient जैसे anesthesia भी जल्दी हो जाएगा patient को, ठीक है, recovery भी जल्दी हो जाएगा. So it induces the anesthesia in a very short period, duration of action is short and recovery is also fast. So propofol is the mostly commonly used IV anesthetic for rapid and short term procedure. So daytime surgery, जैसे पेशेंट आया सर्जरी के लिए प्रोपोफॉल का एनेस्थीसिया दे दिया उसको, सर्जरी हो गया फॉर एग्जांपल विद इन 1 आवर एंड वो आफ्टर 1.5 आवर वो रिकवर भी हो गया एंड ही कैन गो एट होम. सो फॉर द डे टाइम प्रोसीजर सर्जरी propofol is used because it has a short duration of action, it has a rapid induction of anesthesia, and it is a recovery is also rapid, right? So remember. Question number 92. Main complication of succinyl choline. What is the major adverse effect of succinyl choline? Basically, they are asking the major adverse effect of succinyl choline. So, what will be the major adverse effect of succinyl choline? So, what is succinyl choline? So, it is nothing but it is a skeletal muscle relaxant. It is a contact poison. So, succinyl choline is a contact poison or skeletal muscle relaxant. So, it is a depolarizing type of skeletal muscle relaxant. So, skeletal muscle relaxant, they are classified into three types. For example, peripherally acting non-depolarizing type of skeletal muscle relaxant. In that you have D-tuberculare and all the curonium, vacurinium, pancurinium and all that. Okay, so curare alkaloids, they are a non-depolarizing type of skeletal muscle relaxant. Now succinyl choline is a depolarizing type of skeletal muscle relaxant, and due to persistent depolarization, it may cause placid paralysis. So what is the main complication of this succinyl choline? Hypercalcemia and hyperkalemia. Hypercalcemia and hyperkalemia. So it is the complication. Why? Due to blockage of your neuromuscular junction. So what happens? Due to blockage of that neuromuscular junction, there is a more release of potassium inside the cell. So that increases the potassium level of your body. So hyperkalemia also increases the calcium level by releasing the more calcium from sarcoplasmic reticulum. So hypercalcemia. So hypercalcemia, hyperkalemia are the main complication of succinyl choline. Now we will see the question number next. Question number 93. Malignant hyperthermia is the treated with. देखो क्वेश्चन है malignant hyperthermia is treated with. What do you mean by malignant hyperthermia? Due to use of certain drugs, so there is a sudden increase in the metabolic rate of your body. There is sudden increase in the temperature of your body, known as a malignant hyperthermia. Hyperthermia means increase in the body temperature. So malignant hyperthermia means due to use of certain drugs, it increases suddenly the metabolic rate of your body and temperature of your body. So that is known as a malignant hyperthermia. Which are the drug which causes the malignant hyperthermia? So one of the drug is nothing but the succinyl choline. Succinyl choline and most of the intravenous halogenated hydrocarbons. So like your halothane, N-fluorine, sevoflurane, isoflurane. So isoflurane is nothing but the isomer of N-fluorine. So all these IV anesthetics, particularly halogenated hydrocarbons and this succinyl choline, so they causes malignant hyperthermia, and that is nothing but the sudden increase in the body temperature, sudden increase in the metabolic rate of your body. Now it is treated with the dantrolene. Dantrolene is the drug of choice in case of malignant hyperthermia. You have to remember, dantrolene is a drug of choice in the malignant hyperthermia. Now question number 94. Benztropine improves dash in the Parkinson disease. So what is Parkinson disease? Parkinson disease means there is a deficiency of dopamine in the निग्रोस्ट्रैटियल ट्रैक्ट ऑफ योर ब्रेन. सो निग्रोस्ट्रैटियल ट्रैक्ट में ब्रेन में डोपामाइन का डिफिशिएंसी हुआ है. व्हाई? बिकॉज देयर इज अ डीजनरेशन ऑफ डोपामिनर्जिक न्यूरॉन इन द ब्रेन. इट इज अ न्यूरो डीजनरेटिव डिजीज, पार्किंसन डिजीज. देयर इज अ affected gait, then siluria, seborrhea, tremors. So these are the symptoms of Parkinsonism. Benztropine improves the rigidity and tremors in the Parkinson disease, right? Tremors and rigidity in the Parkinson disease. Muscle will become rigid, so muscle का flexibility कम हो जाएगा, उसको बोलते हैं muscular rigidity, right? So this benzotropine, that is nothing but the anticholinergics. So basically, due to dopamine deficiency, there is an increased acetylcholinergic activity in that patient. So in the Parkinson patient, there is a deficiency of dopamine. So dopamine and acetylcholine, they are balancing neurotransmitters in the brain. So if there is deficiency of dopamine, acetylcholine dominance will be there. So acetylcholine dominance causes this lot of symptoms like siluria, seborrhea, tremors, okay, rigidity. These benztropine and all that. So all these drugs are anticholinergic drugs. They will block the acetylcholine and will improve the tremors and rigidity in the Parkinson patient. Now we'll see the next question. Question number 95. Levodopa is converted into dash in CNS. Levodopa क्या है? Levodopa is nothing but the drug used in the treatment of Parkinsonism. So levodopa is a pro drug. ठीक है. Levodopa is converted into dopamine in the brain. So dopamine as it is cannot cross the blood-brain barrier. So levodopa is the prodrug of dopamine, which is converted into dopamine in the brain, and it will fulfill the deficiency of dopamine in the brain. So, okay. Now another levodopa and carbidopa. Levodopa and carbidopa, they are combined together in the treatment of Parkinsonism. Why? Levodopa is metabolized in the blood by peripheral dopa decarboxylase enzyme. Okay, so very little amount of levodopa will reach to a brain. So to increase that amount, carbidopa is the drug. Carbidopa is known as a peripheral dopa decarboxylase inhibitor. So peripheral dopa decarboxylase, dopamine को decarboxylation करने वाला enzyme जो है, that is in the blood, dopa decarboxylase. In the brain, dopamine is metabolized by that MAO and COMT, but in the periphery, in the blood, it is metabolized by your dopa decarboxylase. So dopa decarboxylase, okay, that is inhibited by carbidopa. Carbidopa and levodopa, they are combined in case of your Parkinsonism. Why they are given in a combination? Because carbidopa will inhibit the peripheral dopa decarboxylase enzyme and will increase the level of levodopa, which is reaching to a brain. Levodopa is the prodrug. Next question we will see seleginine selectively inhibit. Now what is seleginine? Seleginine is a drug which is also used in the Parkinsonism. Seleginine जो है वो Parkinsonism में ही use किया जाता है. So it is known as a COMT inhibitor. It is known as a MAO inhibitor. Seleginine is nothing but the MAO inhibitor. What is MAO? Monoamino oxidase inhibitor. So there are two isotypes of MAO, MAO A and MAO B. So seleginine inhibit the MAO B. Now what is the role of MAO A and what is the role of MAO B? So MAO B is involved in the metabolism of dopamine. MAO B जो एंजाइम होता है वो डोपामाइन का मेटाबॉलिज्म करता है, and that's why inhibition of MAO B by seleginine is helpful in the Parkinsonism. Now what is MAO A? So MAO A mostly metabolizes the noradrenaline and other catecholamines. So that's why MAO A inhibitors, they are used as a antidepressants, and MAO B inhibitors, they are used in the Parkinsonism. Okay, you have to remember. Now we'll see the next question. Question number 97. Half-life of sumatriptan. So half-life of sumatriptan is less than 2 hours. It is a half-life of sumatriptan is less than 2 hours. Now what is sumatriptan? So it is a 5-HT receptor antagonist. Sumatriptan is a 5-serotonin receptor antagonist. It is a drug of choice in the acute attack of. Half-life of sumatriptan is a less than 2 hours. What is sumatriptan? It is a half-life of sumatriptan is less than 2 hours. And what is sumatriptan? It is a 5-HT3 receptor antagonist, and it is a drug of choice in the acute attack of migraine. Sumatriptan is a drug of choice in the acute attack of migraine. You have to remember. Now, okay. Question number 98. Marked respiratory depression is caused by which depressant? जो सीनियस डिप्रेशन ड्रग होते हैं उसमें से कौन सा सीनियस डिप्रेशन ड्रग ऐसा है जो रेस्पिरेटरी डिप्रेशन करता है? तो आंसर फॉर दिस इज नथिंग बट द barbiturates. So barbiturates are nothing but they are the derivative of barbituric acid. They are the derivative of barbiturates. They are used as sedative, hypnotic, anticonvulsant drugs. So they are also GABA A receptor agonist. They binds with the alpha subunit of GABA A receptor and increases the duration of opening of chloride ion channels, which is the hyperpolarization of post-synaptic membrane. So they are a sedative, hypnotic, anticonvulsant drugs. Now next question is nothing but the marijuana can be detected up to deadest month in the urine, or marijuana can be detected in the urine up to deadest month of last year. मतलब so up to 1 month you can detect this marijuana in the urine. So it is a longer acting drug. Its metabolites are there in the urine, so you can detect. Now question number 100. Treatment of Wernicke-Korsakoff syndrome. Now this syndrome is very important. Wernicke-Korsakoff syndrome. So what is the treatment of Wernicke-Korsakoff syndrome? So basically it is a vitamin B1 or thiamine deficiency disorder, right? Wernicke-Korsakoff syndrome, thiamine deficiency disorder, vitamin B deficiency disorder. So obviously treatment includes the vitamin B1. Now what is that Wernicke-Korsakoff syndrome? Deficiency of vitamin B1. There is a poor development of your nervous system. So neural system will be developed very poor. Encephaly, hydrocephaly will be the problem. Again, anterograde amnesia, retrograde amnesia, these are will be also a problem. Ataxia will also be a problem. So this is nothing but the symptoms. Anterograde amnesia, okay, then retrograde amnesia, ataxia, okay, mental abnormality. So these are the symptoms of Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome. So that is due to deficiency of vitamin B1. So you can order this magic bullet for GPAT Niper DI Pharmacist. Read twice and qualify 100%. It's our guarantee. You can expect at least 55 to 60 MCQs in upcoming GPAT exam from single book Fundamentals of GPAT Niper DI Pharmacist Volume 1. You can see we have very much promising results. Thousands of students they are already placed in the Niper. You can also join our GPAT Niper 2024-25 online crash course where you will have live lectures, recorded lectures, study material. All the lectures will be subject wise and chapter wise. Study material will be there in a hard copy. Online test series will also be there. Everything is there in 8,000 and you can, if you get all India rank less than 20, your fees will be returned in the form of.
Hello students, order the magic bullet for GPAT Niper Drug Inspector, read twice and qualify 100